Best cheap auto insurance in California. Surveys show that many people are still unaware of what healthcare reform means for them, so you may be wondering whether you'll see any changes when you go to the doctor. With some healthcare reform already in place and more to come by 2014, you'll be seeing changes both in doctor care and in insurance coverage. After September 23, 2010, insurance companies can no longer stop you from covering your child up to the age of 26 if their job doesn't include health insurance because of a pre-existing health problem. Insurers are also barred from limiting the amount of coverage you can receive in your lifetime. If you purchase a new California health insurance plan after September 23, you'll see even more improvements. With a new plan, you'll have access to preventive care with no out-of-pocket costs. You'll also have a right to select your own doctor in the insurer network. If you need out-of-network emergency medical services, insurance companies will no longer be allowed to charge you more than if you used in-network services. In California, there's a big push to get doctors' offices up to the standards that will be required in 2014. To comply with the nation's healthcare reforms, doctors need to convert to what has been called patient-centered medical homes. That goes beyond mere record keeping. It leads to a new, more proactive way to treat patients. Backed by a $145,000 grant, a series of seminars are in the making to help doctors improve care decisions and prevent valuable information from being lost. For example, when lab tests are ordered, doctors need to track when the tests are done, whether the patient has the results, and how the results change the patient's treatment plan. Susan Hoagland of the California Academy of Family Physicians sees this as a critical component of improving patient care. There are many places where care decisions can slip through the cracks, she said. With an electronic medical record, you can see where it is. That's critical to the improvement of care and closing the care loop. CAFP had received a grant from the Physicians Foundation to help California physicians research, fund, and implement electronic health records in their offices through online resources. Because they are often the first or only contact many families have with medical personnel, small staff family medicine practices may be the backbone of our healthcare system. Unfortunately, such primary care physicians are also more likely to have the most trouble computerizing their records. These offices are often the least equipped to invest in such a major change. With a constant flow of patients coming through the office and lower rates of income in specialist small office family medicine practices may have a hard time finding both the surplus cash and off-hours time to get a new record-keeping system up and running. To help, funds are available from Medi-Cal and Medicare to help doctors evaluate which system would work best for them through online resources they can use whenever they have time. With such changes, California health insurance plans can provide you and your family preventive care at no additional cost. When your doctor gets on board with electronic health records, you're also likely to see more effective healthcare planning. These changes all add up to better care with lower out-of-pocket costs. Now is a great time to comparison shop for health insurance in California.